In this video, we're going to talk about the different methods we can use to sterilize parenteral products. However, I want you to keep in mind that we can also use these methods to sterilize non-parenterals as well. There are 5 main methods: dry heat sterilization, steam sterilization, sterilization by filtration, gas sterilization, and ionizing radiation sterilization. Before we get into each method, we need to understand what sterilization even is and why it is an absolute requirement. Sterilization is the process of complete elimination or destruction of all forms of microbial life, including bacteria, viruses, fungi, and spores. Basically, it's when we kill all viable microorganisms, and it is imperative that we sterilize parenterals because, as we said before, if anything harmful is injected into the bloodstream, then the patient is placed in a life-threatening situation and it becomes difficult to save the patient in time due to the complications which occur. In general, we can categorize sterilization techniques into physical methods and chemical methods. Before we begin talking about the first type of sterilization technique, I need you to know that there are actually 2 methods which implement heat: dry heat and moist heat sterilization. Beginning with dry heat sterilization, it eliminates microorganisms using heat. It is carried out in a thermostatically controlled oven over temperatures ranging between 150 to 170 degrees Celsius and for a duration not less than 2 hours. The greater the temperature, the less time required will be to kill all the microorganisms. It is generally known that dry heat is much less effective at killing microorganisms than steam at the same temperature for several reasons. The most notable being that steam rapidly transfers heat as it condenses directly on the surface of the product to be sterilized, and the moisture in steam also helps in denaturation of essential proteins. Hence, to achieve the same efficiency as steam sterilization, higher temperatures and longer periods of exposure are required if we were to opt for dry heat sterilization. Generally, this is the method of choice when we want our apparatus and containers to be dry. We also use it for heat-stable powders such as zinc oxide, sterilizing glassware and surgical instruments, and substances impermeable to moisture such as fixed oils, glycerine, mineral oil, and paraffin. It's also important to note that we cannot sterilize rubber, plastics, and aqueous solutions using dry heat sterilization. In contrast, steam sterilization, also known as moist heat sterilization, employs a mixture of steam, pressure, and high temperatures to sterilize the parenteral product. We carry out this type of sterilization using an autoclave, which is this device right here. An important point for us to understand here is that microorganisms are destroyed by the heat itself, not the pressure. The pressure is simply implemented to increase the system's temperature and therefore increase the efficiency of the process. But what about the steam? The steam enhances the heat's ability to kill microorganisms. Whoa. What does that mean? Well, steam is an excellent medium for transferring heat as it can easily penetrate and evenly distribute heat to all parts of the product being sterilized. Once steam condenses on the container, the thermal energy transferred to the product will kill the microorganism. As such, this is the method of choice for sterilizing parenterals if the product can withstand it, meaning that if the product is not susceptible to breakdown by moisture or heat, steam sterilization is the most commonly used method. So, we've already established that a combination of steam, pressure, and heat all work together to kill the microorganism. But how exactly are they killed? The moist heat causes irreversible denaturation and coagulation of the microorganism's enzymes and other essential proteins. In order to ensure that the heat is efficiently transferred to the product to rid it of any microorganisms, the steam must make direct contact with it. We use steam sterilization for bulk solutions and solutions in ampoules, and for glassware and surgical dressings. The next type of sterilization method is sterilization by filtration. As its name implies, It is the physical removal of microorganisms using filters like the ones we can see in this diagram right here, which we have attached to the injections. But depending on the type of filters we use, we can subdivide filtration into sieving and adsorption. Sieving is done with membrane filters and adsorption is done with depth filters. So what's the difference between membrane filters and depth filters? As we can see from these two diagrams right here, both types of filters will block microorganisms from passing through, but depth filters block less of them. Therefore, only membrane filters are considered reliable and suitable for the removal of microorganisms, again, as we can see from this diagram right here. The filter itself is composed of the filter material, which can be cellulose esters or other polymers, and pores, which actually make up the majority of the filter. The way this works is that when a liquid is passed through the membrane filter, all particles and microorganisms larger in size than the pores are retained, and the liquid product is small enough to pass through the filter. In this way, little product is retained while microorganisms are held behind. The downside to this method, though, is that if the liquid contains lots of particles, the pores in the filter will become blocked quickly, and even the smaller product particles will become trapped and won't pass through the filter. In order to combat this problem, pre-filters are often used. We use this sterilization method for thermolabile solutions, and notice here that this is an advantage it has over dry heat and steam sterilization techniques. We can also use it for ophthalmic solutions. Gas sterilization. It entails exposing the product to certain gases such as ethylene oxide and propylene oxide. Ethylene oxide is the most commonly used gas in this process as it has a greater penetrating ability. While it has a downside of being toxic, it exhibits bactericidal, fungicidal, virucidal, and sporicidal properties which compensates for this. Upon contact with air, ethylene oxide and propylene oxide are highly flammable, so they must be diluted with an inert gas such as carbon dioxide or nitrogen, or with a suitable fluorinated hydrocarbon. There are certain things that we can do to enhance gas sterilization. We can increase the humidity and the pressure of the system, but this only holds true if the material to be sterilized can withstand these conditions. If it cannot, then the exposure time is simply increased to achieve the same results. We can use this method for heat-sensitive and moisture-sensitive preparations, and notice again that this is an advantage it has over dry heat and steam sterilization. It can be used to sterilize catheters, needles, and plastic disposable syringes, and heat-labile enzyme preparations and certain antibiotics. Finally, ionizing radiation. There are two types of ionizing radiation that we can expose a parenteral product to: electromagnetic radiation and particulate radiation. What's important for us to know is that the radiation does not cause a significant increase in temperature, and so oftentimes it is also called cold sterilization. It is a quick process and has great penetrating ability, just like ethylene oxide gas. In terms of its mechanism of action, radiation targets DNA with the aim of affecting the cellular multiplication process of the microorganism, and also damaging its other vital components such as RNA, enzymes, and cell membranes. However, the use of radiation is very limited nowadays due to the need for highly specialized equipment. If it is used, it would be used to sterilize thermosensitive materials such as plastic and already packaged products. Before we end the video, I want to recap some important differences between the 5 different methods of sterilization. We use high temperatures during dry heat and steam sterilization. If we need to sterilize a thermolabile substance, we would opt for anything that does not involve heat, such as filtration, gas, and radiation sterilization. Only gas sterilization poses the risk of using a toxic chemical, and only ionizing radiation requires the use of expensive equipment. And that will be all for this video.